This is a bridge regression lesson, which you can use if you're having pain with the normal bridge, or if maybe you're not strong enough to perform the full bridge, you can work on the things that we're going to learn today. So we're going to follow everything that we used to get into the bridge. So we're going to connect our back anchor, we're going to breathe, relax in the position, push away from your back anchor, and I'm going to go through all of that with you. And the other thing that I want you to focus on is if you're having pain, we need to figure out why your pain is happening, and part of that is going to be where it's happening during the bridge. If it's happening at the top of the bridge, when you come up into the highest point that you can come up into, then it's highly, highly likely that the pain is because you're coming up higher than you're ready to come up, and your hip flexors, which are very strong and probably tight, are pulling your pelvis into an anterior rotation and causing some compression in your lumbar spine. So that is the most common reason why people get pain with the bridge, and so that's very highly likely, especially if it's up high in the bridge. If your pain is down low, maybe in the initiation of the bridge or somewhere in the middle, then it's going to be a little more complicated. We're going to have to ask some questions. For example, is the pain on your back of your ribcage from pushing into the floor? If it's kind of like a tenderness type pain, that might just be your ribcage not being used to that kind of pressure on a firm surface. And that's nothing really to worry about. You're going to get more used to that over time, and as your tissues just build up some resilience. So for a lot of people, they haven't gotten down on the floor in a long time, and so you have to build up a little bit of kind of like calluses on your body to tolerate laying on a firm surface. So let's get right into it. I'm going to walk you through the process, and we will offer some alternatives if you are experiencing something like what I'm talking about. So we're going to get into the supine position so that you can connect to your back anchor. And so I always like to just lay here and relax and breathe without trying to do anything at first. And then I want to become aware of my rib cage, and right now I can kind of grab it. It's a little tight, so I want to bring that down to connect the back of my rib cage with the floor, and that makes my rib hump go away a little bit, and it engages my abdominal muscles. So this is not 100% engagement. It might be 10 or 20% engagement. The lower, the better, just for achieving the connection. So if you're having pain with this, it's most likely just tenderness pain. This is a very extremely low impact thing to do for the body, so it's not really something to worry about. You need to be able to do this. And so we'll go on to the next step, which is pushing away from my back anchor. So I'm going to push into the ground with my back anchor. My abdominals are engaging even more, and it's elevating my pelvis. Now, if you're having pain with this may be related to getting a little bit of forward bending or flexion in your lumbar spine, which may be part of the cause of your back pain. And if you're going through life with very weak hip muscles and you're reaching forward or bending forward to do things like brush your teeth or do the dishes or house chores or everything that you do in life, if it's mostly coming from movement in your lumbar spine, then we're overusing your lumbar spine and not using your hips enough. So the bridge is going to be a good exercise for you to strengthen your hip muscles to get a little bit more function out of them. But this very subtle, low impact, low intensity flexion of the spine is just a cue that that is the motion, because it's the only motion that's happening, that may be irritating your spine. And it's not something that's going to injure you, but it's something to take note of in your daily life. Okay, lumbar flexion or forward bending of my lower back causes a little bit of pain. Maybe I'm doing that too much and that's a repetitive trauma, so I need to start learning how to use my hips. And we are absolutely going to be doing that in this program, so you're in the right place. Now, if you can tolerate this, so a little bit of lumbar flexion, pushing away from the back anchor to initiate the bridge is okay, but then you come up a little higher by engaging your glute muscles, your hip muscles, to bring you up into the bridge, and you're having pain up here, this is the point at which, I was talking about earlier, your hip flexors are going to be pulling on your pelvis, trying to rotate it anteriorly. And so when that happens, it does cause some compression in the lower back, and this is something that we want to resist. We want to try and maintain the posterior rotation of your hips, and that is done through abdominal connection and your glutes, which are necessary for doing the bridge. So if that's happening to you, the best thing you can do is just practice lower in the bridge. Don't feel the need to come all the way up into the bridge and associate that with more benefit. So coming up higher in the bridge is not associated with getting more benefit. The most benefit you can get from the bridge is coming up to the point where you start feeling your hip flexors pulling your pelvis out of position. And once that starts happening, if you come higher, you're going to lose the tug of war. You're going to lose that battle against your hip flexors, and you're no longer getting benefit by coming higher. So you want to stay lower at the point where you can win the tug of war against your hip flexors and keep your pelvis in that posteriorly rotated position, not allowing it to tip this way. We want it to maintain this posterior position. And that might be just right here, halfway up in the bridge. And so you can stay here and just work in this range and get the most benefit for your body, because you're engaging your abdominals, you're learning a healthy core connection, you're doing some movement, and you are not hurting yourself, not potentially setting yourself back. And as you get stronger, as your abdominals get stronger, which hold your pelvis in this healthy position, and your glutes get stronger, you'll gradually, over time, over days and weeks, be able to come up higher, a little bit higher, and continue to win the tug of war against your tight hip flexors. And then if you're shooting for small gains every day, over a couple weeks, you will be able to come up into the full bridge and maintain that neutral pelvis that we want without pain. So I want you to look at this as a long game and take a slow approach to this process. And there's one last thing you can try if you don't fit into any of these categories. You can take something like a yoga block, something of similar thickness also will work, and place it right under your pelvis, right under your bum, below your lower back, and just rest on this block. And if you get no pain with this, then another modification you can try is just practice engaging on this block. I don't even have to lift up off the block. Engage my abdominals in the same way that we're doing with the back anchor. And I'm engaging my glutes and experiment with that. And if you can, maybe even come off the block a little bit and go to the point just before the pain would come on. Don't go into the pain, don't push through, stop just short of the pain and practice within that range. That's the general rule you want to do. And so something like a block can help you just experiment in a higher range, because then you can just relax down onto the block and come off of it and just really focus on that higher range. But regardless, if you're using the block or not, the same rule applies. Go stop just short of the pain and practice within that range. So give it a try and work on little bits of progress each day.